Welcome to the lecture on quality control. What you'll learn in this lecture is that efficient problem solving is stepwise. You'll use familiar tools, check sheets, Pareto charts, Ishikawa diagrams, and key driver diagrams. What we'll show you is how to use these tools in the correct order in order for you to get to the true root cause of the problem. Your role as an improvement leader is to teach the frontline staff efficient problem-solving skills that they can apply every day. The contents of this lecture come from this book, The Guide to Quality Control by Dr. Ishikawa. Dr. Ishikawa was an engineer at the University of Tokyo in the 1960s, and he introduced the concept of quality circles in 1962. The first published example of a Pareto chart actually appeared in this book in 1968. And in 1982, the Ishikawa diagram was developed. And as you will learn in this lecture, we use this diagram to assess what the root cause of our problems are. So we're going to be focusing on a quantitative approach to problem solving. And this means using data to direct the creation of your countermeasures. If you take a purely qualitative approach, and what I mean by that, if you take a really non-data driven approach, you're less likely to find the true root cause of your problem. And when that happens, the problem may persist. So when faced with a problem, you need to think in a stepwise fashion. The first thing you need to do is you need to collect some data. And you're collecting data to find out two things. First, you're collecting data to find out which errors or which defects occur most frequently, which are the most numerous. Second, you'll be collecting data in order to determine what the factors are that are causing these defects. So let's get started. So collecting data. So you're faced with a problem. What's the first thing you do? The first thing you do is you define the categories where there could be a problem. And this is a very important point. The people who do the work, folks on the front line who have intimate knowledge of how the work is done, should define these categories. And the number of these categories are virtually endless. The types are virtually endless. And here's some examples. Categories could be steps in a process, for example. The categories you pick could be the type of defect. So in manufacturing, this could be, say, the raw material is not created incorrectly, or the finishing on a certain material is improper. Types of defects could also be types of waste, such as transportation, the waste of motion, the waste of stagnation or overproduction. In manufacturing, the categories of errors could be causes of machine breakdowns, maybe power supply problems, or problems with the gearing or the lubrication of the machinery. In healthcare, types of defects can also be categorized. For example, in the pharmacy, a category of defect could be the wrong dose of a medication given to a patient, or a misdose, or an improper infusion rate. So once you define your categories, you want to collect the data on what's called a check sheet, and the check sheet will match these categories. And from this data, you'll create a Pareto chart. So once the categories of problems have been decided upon, and again, this decision is made by the frontline staff who know the work the best, you collect the data on check sheets. Here's an example. In this case, the categories of problems that they selected were the steps in the process, and you can see that step A had the most number of problems, 15. Here's another check sheet example where they chose defect types as the categories to collect data on, and in this case, defect B had the most number of problems. It's important to realize that data can be collected either prospectively or it can be gathered retrospectively. For example, A team could examine the medical records of patients who had problems, and they could collect the data retrospectively by examining the chart. Now, this is going to take some effort, but the effort is really well worth it, since doing this will get you closer to the root cause of the problem. And remember, the closer you get the root cause, the more likely you are to develop a countermeasure that will prevent that problem from ever occurring again, which is really what you want to do. This is efficient problem solving. So you're going to take this data and you're going to make a Pareto chart out of it. The data from the check sheets will be used to make your Pareto diagram. On the y-axis is the frequency of the occurrence of the problem, or the category of problem, and on the x-axis are the categories of problems. So you can see here, if you examine the horizontal green line, this represents the 80-20 rule, where 80% is the cutoff point where 80% of the problems come from 20% of the causes. Displaying your data visually like this makes it incredibly clear to the entire team where the effort should be concentrated. Those vital few areas are the ones that you're going to attack first. And oftentimes what you find is that by fixing the most common problems, the problems that are less frequent automatically gets fixed. So this is, again, efficient problem solving. So let's review the virtues of the Pareto diagram. So first, it's a team effort. It's a team effort to collect data and to analyze the data. And again, the Pareto chart shows you where to start. It's the 80-20 rule. 80% of the problems come from 20% of the causes. Now, if you took a different approach, where individuals would be making independent improvements that wasn't coordinated, and you didn't have a definite direction that was followed by all, you'd have a lot of wasted effort, a lot of wasted time. And this is an important point, is that it's easier to reduce the biggest problem by 50% than it is to put a lot of energy into less common problems and make those problems go to 0%. So again, the rule of not focusing on the trivial and focusing on the vital few problems is really what the Pareto chart is all about. So now that you have a Pareto chart made, the next step you're going to take is to look for root causes of the most common problems that you identified on your Pareto chart. And getting to root causes is absolutely critical to designing the best countermeasure. Remember, you want to design countermeasures to eliminate the root cause. And by doing so, that problem should never show up again. It's just like pulling out a weed. If you pull out just the flowers of the weed or the leaves of the weed's going to grow back. It's the same idea in quality improvement. So let's talk about the Ishikawa diagram, and this is sometimes called a cause and effect diagram. And just like Pareto charts, the people who know the work the best should be the one who make the Ishikawa diagram. Again, like Pareto charts, preparing a cause and effect diagram is an educational really journey in itself. And it really helps build teamwork. When like-minded people get together and solve problems together, that really galvanizes their resolve. So an Ishikawa diagram, a cause-effect diagram, is a guide to the discussion. It focuses your team and makes efficient use of time. What it really does is it discovers potential root causes of a problem, and it sorts them visually so that it's easy to see where the root causes are coming from. What they really do is they show why there's variation in a process. And in manufacturing, variation is known as dispersion. And we'll talk more about variation in the upcoming slides. But variation really is due to differences in 4 basic categories. And those are materials, methods, equipment, and measurement. And understanding this relationship between cause and effect is simply going to help you solve problems much, much more quickly. So once again, the factors causing the problems are in one of the four categories that you'll see here below. For each issue, you're going to find the root cause by asking why there's variability there. And then you're going to design a countermeasure for that root cause. And again, properly designed countermeasures prevent the problem from ever happening again. So the problem is placed in the box to the far right, and the four categories are tools, equipment, and machinery. Raw materials, in our case, raw materials may be our patients, or other materials found in various silos around the hospital. Third category is work methods, processes, or people. And the fourth category is measurement, and in healthcare this could be lab tests or other things that we measure. Let's look at a clinical example, and this comes from our sepsis work. So the sepsis work group has been tasked with decreasing the number of cases of sepsis. And based on their Pareto chart analysis, they found that one of the common causes was a delay in ordering antibiotics. So the team immediately realized that there was variation in work processes and work methods and people. And they asked themselves why that might be. And they recognized that the degree of staff experience impacted the time to order entry. And they dug a little bit deeper, and they found that the problem was due to a variation in the appropriate training that surrounded the optimal type of antibiotic to give and the dose of antibiotic that should be given to the patient. So there's a concept that is commonly taught that you should ask why 5 times to get to root cause. So let's review what we've done and show how we've successfully accomplished this. And remember that the key to this analysis is asking why is there variability. So let's go through the 5 whys. First why. Why are patients developing sepsis? Because there's a delay in the delivery of antibiotics. Why is there a delay in the delivery of antibiotics? Because there's variability in the time it takes to order the appropriate antibiotics. Why is there variability in the time to order entry? Because there's variability in work methods, processes, and people. Why is there variability in work methods, processes, and people? Because there's variability in the level of staff experience. Why is there variability in the level of staff experience? Because standardized training is not required for new staff. So we're also able to match up the 5 whys that we discussed in the previous slide with the Ishikawa diagram itself. We start with our first why. Why are patients developing sepsis? Because of delay in order entry. And remember, this came from our Pareto chart. Now we look to the categories of root cause, starting with work processes and people. This is our third why. We do some further questioning about variability in process. We found out that there's variability in staff experience. It's your fourth why. And we ask the fifth why. Why is there variability there? And we find out that the root cause is non-standard training methods. So by being thoughtful, by being methodical, and by being stepwise, and by using the correct tool in the correct order, you can complete your 5 whys analysis. So let's wrap up our discussion around the 5 whys and talk a little bit more about them. I think it should be clear by now that a 5 whys analysis is done with your whole team, and it's not done by yourself. You want to be specific and you want to be data driven, and the Pareto chart is the first step in this. At each level of why, you want to be asking why variation is occurring. That's a very important concept here. You want to stick to the facts. You don't want to be thinking about the solution ahead of time. If you do this, you're very likely to miss an important cause. And if during your 5 whys analysis there are multiple because answers, you'd want to branch off at that point and start a new 5 whys analysis. What you'll find is that the countermeasure that you design to combat the root cause is usually a tool that decreases variation. And this could be an errors report, this could be a visibility system, it could be a piece of standard work that describes how to do a process. And finally, you want to implement your countermeasures rapidly and then look to PDCA the process to eliminate any source of error. So what about the key driver diagram? So what's the role of the key driver diagram? Well, the role of the key driver diagram is to organize the countermeasures and to create a visual representation of that. So some people start a problem-solving effort with the key driver diagram, but as you've seen, that is really using the tool in the incorrect order. What will lead you to the root cause is not the key driver diagram, but it's the order in which you perform this problem-solving effort. You start with check sheets, you create a Pareto, and then you build an Ishikawa diagram. So if you start with the key driver diagram first, before you've done the other steps, you are essentially solution jumping, and there's a higher chance that the problem is going to reoccur. So for the sepsis example, the team designed a countermeasure for the root cause, and that was to develop standard training materials. And you can see there, in terms of secondary drivers, they identified some specific countermeasures. First, they need to develop the materials. They also needed these materials to be endorsed by the graduate medical education department in order to train the staff. And they also realized they needed to track completion of the training. So note that each of those countermeasures is described by what, who, when, where, and how. And a properly executed countermeasure requires that the teams answer those 5 questions: what, who, when, where, and how. Let's talk a little bit more about Ishikawa diagrams. Sometimes when you're creating one with your team, your Ishikawa diagram kind of looks like this. And if the team creating the cause-effect diagram doesn't have a deep enough knowledge of the process, then the root causes won't be found. You won't be able to dig deep enough. And in this case, you're really not able to create effective countermeasures. Now, if you've involved the right people on the team in terms of looking for root cause, if that team has intimate knowledge of the process, they'll be able to dig deep enough to find the root causes, and then you'll be able to develop the right countermeasures. So once you've implemented your countermeasures, you can rerun the Pareto chart and you can determine if your intervention was effective. And if it was, you should see a shift in the frequency of the defect. So in this case, for manufacturing, improper rotation of a material was found to be the most common cause of defects. The team implemented countermeasures, reran their Pareto chart, and now improper rotation is not the most common cause of problems. So Pareto charts aren't designed to be used just once and then never used again. It's a tool that you can use to monitor the progress and effectiveness of your countermeasure. So let's put it all together. You first decide on the categories of problems. You create check sheets and collect that data either prospectively or retrospectively. You use that data to create a Pareto chart, which shows you where your most common problems are, and you concentrate your efforts on the most common problems. You place your most common problems in the rightmost box in your Ishikawa diagram, and use the 4 categories of root causes to do your 5 whys analysis. You get to root cause, you design countermeasures for those root causes, and you organize those countermeasures on a key driver diagram. Each countermeasure is described by who, what, when, where, why, and how. And that is your method for finding root cause and developing countermeasures and improving quality. Thank you for your attention.